Welcome to our 11th Biomedical Engineering Annual Research Day. It's an honor to have Dr. LaBerge from Clemson University. She's the chair of the Biomedical Engineering Department at Clemson. A little bit about her, there's a lot to say. I'm going to try and truncate it to a really short part because she has an exciting talk to follow. So Dr. LaBerge is the professor and also the chair of the Bioengineering Department at Clemson University and the director of the Biomedical Engineering Innovation Campus in Greensville, South Carolina. She received her master's and also her PhD in biomedical engineering from University of Montreal and completed her postdoc work in mechanical engineering at University of Waterloo before she joined the bioengineering faculty at Clemson. She has numerous publications on the tribological performance of orthopedic and vascular implants and is also an inventor to several licensed patents. Since the beginning of her career, she served as the major advisor for over 85 doctoral and master's bioengineering students, managing a research program exceeding over $12 million. She served as the president of the Society for Biomaterials, which is SFB, and received its inaugural service award. She's a fellow of the American Institute for Medical and Biological Engineering, which is AIMBE, and the Biomedical Engineering Society, or the BMES. She was inducted a fellow Biomaterial Science and Engineering by the International Union of Societies for Biomaterials, Science and Engineering. Dr. LaBerge received the South Carolina Governor's Award for Scientific Awareness for major program development. She received the inaugural Herbert White Distinguished Service Award from the BMES and the SEMDA Spotlight Award, recognizing her contributions to the development of the Southeastern medical device community. Today, I guess it's very appropriate to have her during all that we've been going through in the last 6 months, but with a very positive outlook. Thanks to Orlando for putting together a great presentation up front, highlighting all the stuff that students have done. In order to add to it and to complement, and Dr. LaBerge is actually going to be talking not just a science or biomedical engineering, but more building a skill set for successful biomedical engineering research career, which focuses on emotional intelligence. So I will turn it to Dr. LaBerge. Thank you for being here virtually in Miami. It's a little sunny, but we did have the same kind of rains that you said you have at Clemson at this point. So welcome, and I'll leave it to you to take over.
Wonderful. Thank you, Anu, and Ranu as well. This is such exciting for me to be here. I was supposed to be there in April, if you remember. We had to kind of either postpone or cancel this presentation. And I think it was good to do that because then I would have talked to you about vascular implants, which is kind of boring. And we always need to look at the glass half full. And I see what we have learned, all of us together around the globe in the past 8 months, is that we can strive if we look at things positively. And so this morning, what I want to do, it's 9 o'clock, it's very early, is to talk to students. This has nothing to do with faculty members. They know all this, they are living it. They are experiencing it on a day-to-day basis. But you guys are the success, but you also are the future of our field. I really enjoyed the slideshow that Orlando put up, before the session started. And you had such great quotes, like, I'm a BME, what's your superpower? Let's start with this. This is what research is all about. This is creating. So I'm going to share my slides. I'm also teaching remotely this semester. I'm teaching 2 courses. I think I'm not that bad with Zoom, but let's hope that we can get through this for the next 50 minutes and entertain you. We wanted to have some engagement activities, but I guess we won't because the system does not allow us to do this. So we're gonna go with slides, but use the Q&A. You can interrupt me. I'm gonna see if I can monitor that at the same time and be multitasking. This is what BMEs are good at.
I can help monitor that for you, Dr. LaBerge.
Okay, that's great. Thank you.
I'll monitor that and I'll interrupt as
Perfect. Thank you. So I divided my presentation in basically 3 parts. So I told everyone here at Clemson that I'm in Miami today, and they were pretty excited because now we should not be traveling. And then I said, I'm virtually in Miami, so I'm behaving like I'm there with you. And I'm gonna use my presentation in 3 parts. One is a bit to show you what Clemson is all about. This is the privilege of a speaker, is kind of bring a little bit of who they are, and then a bit of recruitment, I would say. And then we'll talk about research, emotional intelligence as being a key to your success. And then I will follow up with my pitch. And my pitch is to kind of say how we can establish and build partnership with Florida International University. We're not that far, actually. So I've been working at Clemson since 1990. You guys were not born then. And interestingly, this is a university that is known for football. You might know that. We're in the ACC. We have a very prominent tiger paw. You're the Panthers, we're the Tigers. And so we're known for this. We're a rural campus, so it means like we are not in the big city like you are. There are some disadvantages, but there are also some advantages in doing this. It makes us work a little bit more because we have to build partnerships and really provide opportunities to our students because the BME community is not rural. And we're known for bioengineering. So this is my class of 2019, and this is the class in orange of 2020. We could not have our traditional Bio bash that celebrates graduation. So we kind of did something special for our students as a thank you card, but also as a recognition of their acknowledgements. So Clemson Bioengineering is known as the birthplace of biomaterials. It started in the 60s. I don't know if you know that the hip implant is you might say hip implant, been people working those for forever. Well, not that much. It started in the 60s. The first time that Sir John Charlie talked about using PMMA as a grout between metal and bone, for hip replacement was at Clemson in those symposia. So this started the Society for Biomaterials. Our inaugural department chair and program director was Sam Halbert. And then after that, in the 60s, they had master's degree. The first PhD students graduated in 1963, and then so forth and so on. So I joined the department, as I mentioned, in 1990. So this was very much anchored. I felt so privileged to be within biomaterials. And the department has grown. And then now we have a undergraduate program, master's, PhD, Master of Engineering program. And then we also have a PhD, DMD with the Medical University of South Carolina. So we are located at 3 places. So this is the state of South Carolina. Just to give you an idea, Clemson is 9 hours driving from Orlando. So then you can do the math between Orlando and Miami. So this is not too much traffic. You can go through Atlanta and things are a bit terrible there, but it's not that bad. It's feasible in 1 day. So there's Georgia here. You have North Carolina. So Florida is just down there. We have 3 sites. I call that the very stable configuration to have an academic program. So at Clemson, we do our major education, BS, MS, PhD. Then since we don't have a med school here, so we do make partnership, as I mentioned. So we have a very strong one with Prisma Health, which is the largest healthcare provider in South Carolina. It's located in Greenville, and this is where we have our Biomedical Engineering Innovation Campus, where our students are co-located with companies. They do research there. We have a cadaver lab. So basically they have the building blocks in order to do translational research and workforce development. And in Charleston, which is right here, between those 2 tiger paws, there are about 3.5 hours to 4 hours of driving on interstate. And then there we have a clinically embedded graduate education program, which spans from Master of Engineering, Masters of Science, and PhD. So took time to build all this. I've been chair for quite some time in this department, so I just finished my 18th year. And I'm very proud of what we've been able to accomplish. And I'm not alone on this. This is what we're gonna learn today. You are just an incremental part of your team. And this is my team. These are the people I count on. These are the people that I'm just a little portion, little pixel of this big picture here. So we're quite a good department divided between bioelectrical engineering, biomaterials, of course, and a lot of translational work as well. So let's get into what we're supposed to talk today. We don't want to take too much time. I have my clock here, and then I always tell my students I never start before and I never finish after, which I always do, by the way. So I'm gonna try to make sure that I don't go over. So why did I decide to focus on this today? It's because this is your day. This is a research day for undergraduate students. This is a matter for your department to celebrate your skills, your talents, and also your passion. And also have great hope for you and goals so that you could take this passion and go forward and have a very illustrious career as a scientist. We're engineers first, but an engineer cannot do engineering without having basic science as well, especially in biomedical engineering. So I thought that to me, the skill set, you know all this. People have told you this. You have lived that. I'm not bringing something new. What I'm going to try to do this morning is packaging in a way that's from a different perspective so that you may say, this is going to open a light bulb for you. So who is a researcher? So I should have put pictures there of you guys, you know, our undergraduate students across all the BME programs in the United States. You are the future of what the field of healthcare is going to happen. We're in the midst of a pandemic. Who is thriving through this pandemic? Biomedical engineering. You are the ones who are going to develop the new PPEs, the new technology. How do we save patients? How do we do better workflow in the hospital? How do we worry about supply chains of getting all this to our hospitals and our patients? So, and as you see that when you watch the news, and I know you guys in Miami, where Miami-Dade and Boca Raton were so much immersed in this during summer. Everybody looked at you and you solved the problem. And I would say there was a biomedical engineer in the background of it. So always take something bad from some perspective in terms of good from another. So these would kind of be take-home messages that we can take out of today. So through this pandemic, we have learned that there is always a question that can be asked. There is always something where we can improve a field. We can get new information, we gather data, and we advance knowledge. All this as a pillar of basic science, engineering translate that. So this is from the dictionary. There's nothing really different there. But you know what? All those people, they're researchers. And you have a core group of individuals you admire, you live with every day. And I put the woman there in some woman in your department because to me, they are the example of passion and then also motivation and how they can be the best mentor of all. And also they are to me equivalent of those we may know better, more worldwide, like Einstein. You know, this is Bob Langer. Bob Langer is one of the most famous biomedical bioengineer in the world. Bob Langer started tissue engineering. So, and this is definitely the seminal paper that started a field that revolutionized what we're doing now in healthcare and the promise of it. Bob Langer is also the founder of Moderna. You know about Moderna. This is the company that everybody has their eyes on now. This is the vaccine that is going to make sure that hopefully next semester we go back in person and don't have to stay home isolated to take our courses. And Rena Bezios has been a mentor of mine since I started my career, and I hope she will be a mentor of yours. You've seen her name. She writes textbooks in biomaterials, and you probably all have either one in hard copy of one that is download text that you're using for your classes. What Rena has been doing is building a pipeline of researchers. So these are those 6 individuals to me. You want to be like them one day because they are inquisitive. They have resilience. Aren't they patient? They have to be. Because when you do research, it's always the cycle of, if it was easy, someone would have done it. So therefore, since you need to research, there are ups and downs, and then we need to close the loops, and it takes a long time. Aren't they meticulous? Everything they publish, has been scrutinized. Everything that is published as statistical analysis triplicates more and more so that data converge. They're thorough in what they're doing. What does that mean, being thorough? Thorough in our field involves the responsible conduct of research. And that's something that you should also follow in your undergraduate research. I always bring the word passion, because to me, passion, this is what the major element that it takes to do research. You never give up. Times are low sometimes, you know, you've seen those. You have some drawbacks, you know, sometimes you cannot have access to your lab because of a virus. So these are all hurdles that we have to go through, but your passion makes sure that you stick there. If you're low down, you stand back up and then you continue. And all of them are game changers, and you are game changers. You're bringing one little increment to solve a problem that will have a major impact one day. So what do they all need, all those 6 famous researchers? Well, they all started with an idea. So these are, to me, the 5 elements of having a very strong research programs. So if you have not said thank you to your advisor right now, you need to do this. First of all, you will impress them because no one ever tells us thank you. So we just do it as granted, like we have to do, it's part of our job. But it's also part of your job to recognize what is needed and all the hard work that is going into building for you a setup where you can thrive and then you can be successful game changers in the future. They need an idea. So all those labs that you have are started on a research platform. You may be working on different ideas, but at the end, it just falls within the umbrella. They have an idea, and then they are professional beggars. You need money, a lot of money. Everything you're doing, especially in biomedical engineering, is so expensive. An assay is $800 if you're doing anything with DNA. All those PCR tests that we're doing, this is expensive. Those machines are. They need space. They have to go beg their department chair or a company or stakeholders to get lab space because they need to do the work somewhere. Within the lab space, then you need expensive equipment, because what we do in BME is not just computational work. We do a lot of experimental as well. And then they need you, they need people. You can have all those 4 elements. If you don't have this one, nothing will happen. So you are basically the essence of having a strong research program: minds, talents, and passion. So these are I'm going to try to put pictures. I wanted to show you, introduce you to people from Clemson. So these are our students and my colleagues. This is Professor Gao. Actually, he got his PhD at the University of Miami, not too far from me. So I'll do that during my talk. But these are researcher core competencies. I divided that in 3 buckets, you know. So of course, you need to know what's out there. You don't duplicate. You need to know about creative and innovative thinking. You need to be aware of compliance and ethics, especially in what we do. We work with patients. We understand HIPAA. We also have responsible conduct of research that we are very familiar with. We use animals in what we're doing. We use humans in our research. So that's something. And then you have your hard skills, where you know what to do. You can use computational modeling. You can do analysis. You can do gamma rays. You can do microRNA analysis. You can do all this. You can analyze them, and you communicate them. You have wonderful communication skills, both written and also oral communication skills, speech. I know that you also know that biomedical engineers on all campuses in the United States are the students or the bridge makers. You have the most prevalent communication skills that anybody would have. You master the right side and the left side of your brain all the time. You know how to intersect that to do your work, to do your research, do your classwork. So that's a talent that you have that others, and the mechanicals don't have that, electricals don't either. But what is needed that we don't learn in the classroom, and this is something that I'm 60 years old, you're 20. I don't want you to wait at 60 to be able to do this. You need to do that now. Patience Patience will take you a long way. Patience is be able to sit down, think, and take a decision a bit later. Sometimes your decision may change. Time management. You will be presented with so many opportunities in the future, and they will be all great. You will want to take them all. How do you manage your time? Are you able right now to have wonderful research projects and then also be able to publish? Because in our field, if we don't publish, we perish. Y'all know this as well. And you are able to have a life. You don't burn the candle by both ends. You do a lot of creative avoidance. You can ask me that what it means, creative avoidance, at the end. I like to talk to you and see how it comes up. And teamwork. Now on your team in research, you're likely to have physicians. You're likely to have industry working with you. You're likely to have students on different majors. You have an advisor. You have postdocs. What a big team you're working with. And there's you as a central element of this. Remember the people? And then you need to have leadership skills. So these to me are the 4 major skills that you need to have before you graduate. You say, I'm mastering this, I'm able to go. And then you'll be able to go forward much sooner. You don't need to wait until you're 40 to be famous. Let's say at 25 you'll be. So teamwork is important. So when you walk in your group, a little bit we're intimidated, aren't we? Because postdocs, they worked on that for a long time. Your advisor, this person is famous. This person has published. This person has an H index. This person has a lot of citations. And then you come in, you're all green. Well, you're not green, you have ideas. And what your advisors have mastered over time are those 7 criteria. So if you would have access to my slides, you can just cut and paste the website and go check it out. There is a book on this. It's called The 7 Essential Skills of Teamwork. So they listen. They only question you, especially in the morning at 8 when you have to go to a group meeting and then you partied a lot last night. And then you're afraid of the questions they're going to ask you because your neurons are not totally up to speed right now. So they're going to persuade you, keep going, it's going to come up. I need more data. We need to write this paper. And you do it. They respect you, but they also ask mutual respect from you guys. They're helping. They open doors. When you need their help at 5 o'clock at night, you text them, or you knock on their door when we don't have COVID-19, and then they are there with welcome arms. They have shared with you their knowledge. Our goals as instructors, advisors, researchers is to make clones of ourselves. We want you to be all better than we are. And they're participating. They attend group meetings, don't they? They're there. If they're not there, someone's in charge. So now we talked about researcher. In society, they are people who have done great things for the world. One of them is Steve Jobs. Who does not know Steve Jobs? Without Steve Jobs, I don't think we would be talking the way we are right now. That would not be possible. And then this is a man who really believed in his team. He was just a little pixel of the big picture of his team, his company, his enterprise. It was a culture that Steve Jobs has instigated. So culture, together, teamwork, alike. You're different. Diversity is very important. Diversity is about, like, we've been immersed in diversity in a way that maybe we don't like to talk about. But we forget that diversity is what makes science strong. If we all think alike, we're not going to progress in our thinking process. So we have to bring diversity, that be gender, that be ethnicity, that be background, that be height, that be like, you know, all the background you're coming up with. So this is part of the essence of doing great things, team focus. Wouldn't you say, or agree with me, that Steve Jobs was an awesome leader? His legacy is still here. We see him present. Steve Jobs still a leader. His culture is there. And you see a lot of quotes on that. But look at this one. Before you are a leader, success is all about growing yourself. Get those skills under control. When you become a leader, success is about growing others. You know what the success in administration is? And I'm saying Dr. Young in front of me, and she will agree to that. You become a true administrator when it's no longer about you, but it's about them. It's about you. So do that earlier on. Be ahead of the ball game. Don't wait until you're 40, 30, 50 to make those things or to do that. So leadership is a team, as a team. Leading is when you lead a team, therefore. So you need to organize your people. How do you do that? When your advisor picked you in your lab, didn't they ask questions? They didn't want to share your passion. They didn't want to know what you've done, a little bit of your culture and all that. They were checking you out. They were building their team. And so efficient leadership is always based on teamwork. So I have all those famous quotes there. You can Google those. There are plenty. Especially now, I think, didn't you see the places like our universities? I hope you're very pleased with what's going on at FIU. I am with Clemson, and the way our leaders have been able to guide us. So this is a good test on leadership, test on patience, what we're living on now, this crisis, but a good test on leadership. And one thing that now is even more prominent than ever is to bring this quality that Eleanor Roosevelt told us very clearly. To handle yourself, remember, these are the steps of leadership. You need to use your head. This is what you guys are doing now, building your skills. To handle others, use your heart. For so long in old management, we were not told that. You have black and white, need to tell your people to do that. They have deadlines to meet. We have customers to answer. No longer. That does not work. So you have generations who have suffered. You guys won't, because you're learning the right way. And all this is under the heart part, under emotional intelligence. Emotional intelligence is today what IQ was many years ago. So now we're talking about EQ, which is emotional intelligence. This is basically that self-awareness. How do I take my heart? How do I take time to listen, to hear others, and make a decision? To me, it's founded on patience, even though we might not say it that way. So the grandfather of EI, or EQ, is Daniel Goleman. And again, you know, you can Google him. He has written a book, which is kind of the seminal work in what is emotional intelligence and how it can change a business. I don't know if you have read the book Good to Great. You're going to say this is your generation, maybe it is. Good to Great by Jim Collins. You can always, this book, it's still available in airport newsstands. And Good to Great is about how to make something good better. You know, we should never be satisfied. We should always try to do better with ourselves. And this is what Daniel Goleman did that for the 2020s. So emotional intelligence, I put COVID-19 here. This required a lot of emotional intelligence to go through what we did with healthcare. And biomedical engineers were at the essence of this. It's team focus. It uses empathy. But now bring another word, collegiality. You have one of the most collegial departments in the country, and I know that because you always do what your leaders do. And your leader is the most collegial person I have met in the field of biomedical engineering in all the years I have worked. So you guys, you don't have a choice, you have to be collegial. Again, there are books on this. And I don't have the attention span to read a 300-page book. I don't have the time. I have to do other things important than this. But people have summarized them in one-pagers, which is a good thing, so you can read that. That will bring something else that is very current right now. Sympathy versus empathy. I will not do politics today. I refuse to do this, but I have strong opinions. And now I think it's the way to go. You can have opinion and post it. I don't do Twitter, so don't try to check me out on this. But I can tell you that because the difference between both is very important, I should have dashed this, but I copied this picture from the internet, so therefore I couldn't do it. You need to have a dashed line here. This is not one or the other. You need to have both in what you're doing on your day-to-day career as a researcher. At the end, don't worry, we're all gonna wrap this and it's gonna make sense. What is it having sympathy? You know, when you have someone in your lab who you know just a little bit like that, and then this guy loses his grandmother. So you say, please accept my sympathy, all my condolences. You were so fortunate, no one in your family passed away yet, or someone close to you. You have not lived this experience. You cannot put yourself, really, you don't think, in the feet of your friend who has lost a grandmother. If you have done it, then you would say, don't worry, it will take time. You know, we're gonna go through, I can help you. You can share with me, my grandmother passed away last year. It feels really bad. You lost a big part. This is the empathy. You put yourself in the shoes of the other person. Let's take that to research, okay? So your advisor says you come to, and I always say mentoring, we should talk about mentoring. I like my colleagues to be mentored. A mentor, I say, is when they have a tissue box in their office, they're a mentor. Because you're not afraid to go to them and cry there and say, I lost my logbook. Or computer crash, I didn't save. These are all things that happen to us. Or my data are not going anywhere. My boyfriend dumped me. And so you go there and you express your feelings. What is your advisor gonna say? It's okay, you'll be fine tomorrow, go back in the lab. What are you gonna say? He doesn't care, she doesn't care about me, they don't care about me. And then you're gonna be even more down. Your advisor will say, give you the tissue box. I just have wipes, I cannot give you wipes, but I give you a tissue box and then say, you know what, let's talk about it. Let's take time to really think. Do you need some time on your own? Do you need this and that? The logbook, we'll find out. We keep copies of something. Hopefully they did keep a copy. Always keep a copy of the logbooks. This is empathy. What do you think between both? I wanted to do polls where we can do that. What do you think is the one who's gonna get the best result? This person is going to pep you up. You're gonna go back and you're gonna say, okay, I'm gonna breathe deeply now and I'll be fine. In a research, this is needed. We need to be emotionally intelligent. We need to have empathy. Okay, so there are key components of this emotional intelligence. There is a recipe to get there. We're not born, I guess, with emotional intelligence. We live it. It's just like learning another language. You know by now that English is not my first language, so French is. So I have an accent. And then I learned English by being immersed in it. So we need to be immersed in the concept of EQ. So what is it? Four components that will be of essence to it. 4 building blocks. Self-knowledge, we're gonna cover each of them. Managing your emotions. These are different emotions that we all go through in a day. You know, if you are the one upbeat to say, I am, the smiley face all day long, I want to know you, I want you to be my friend. Because we go through all those different experiences. How do you manage those emotions? Through self-knowledge. Understand others. Communicating as well. Understanding is part of managing your relationship. So if we want to make it in engineering terms, black and white, who am I? What are they thinking? How can I talk to them and have better communication skills? So, self-knowledge. You know what, Zoom? You guys do that for your lecture. Beginning, you can put a background in mine, so I wanted to showcase Clemson. We're very color focused here. We're orange and purple. And also my office is not clean, so I didn't know how to show you that. But you can see mirrors. You can see how it looks like. You can flip it. When you use your cell phone, you can do a flip and see on photos how you look like. Selfies. People to take selfies of themselves. This is another way that you kind of see yourself through a screen, through a mirror. Why don't we take the time now to think about what others are seeing when they look at us? That's the other mirror. That's the mirror, we cannot change the way we look. I cannot change the background in my office. So Seeing ourselves as others see us. This is the mirror. I would like them to see me smiling all the time. This is comforting. When Dr. Young goes to her office and she said, I'm not in a good mood today, all the staff will be in a bad mood. Mariam will be, Anu will be, everybody. But when she goes there with a smile on her face, upbeat in the office, great day, isn't it? So she knows that. She's a great leader. She hides her cards. You need to do the same. What button to push? Sometimes your advisor has to be tough on you. If you procrastinate too much and data don't get in, don't blame it on your advisor, because they have to do this. They know what needs to be done. They push the right button. But they also understand feelings. So they have empathy for that. You probably all seen the movies of Harry Potter because you live in Orlando, in Florida. You're close to Universal, and I'm a big fan of Harry Potter. And I used to love going to Universal and doing all this, so I envy you guys. Maybe one day I'll be a resident of Florida and get the discount. But you know what? This is the mirror. This was in the first movie. Sorcerers of Stone. What Harry did is saw his family. That was a happy thought for him. It gave him power to go. So it's basically the image that we want to represent to others. We'll give them a reaction to it. Self-knowledge is also about mindful. I love emojis. I think it's very current. You don't need to, and they're all free. You can just download them for free. So you put those on your ears right now to listen to others, to be focused. It's a great thing. But it's not annoying when someone has those earbuds, or earmuffs, and then they listen to music and not pay attention to you. Well, this is what it would be, not being mindful of others. It's this. So mindfulness emphasizes collaboration. We need we need that. We need listening skills, and we need to control our emotions. How do we manage our emotions? Keep your cards. Show the face you want people to see. Don't let them see you down. Some people will need to see you down because you need to outreach to them. Not everybody. You pick the attitude that you want to be, the empathic attitude, and also the positive attitude. Controlling outbursts is keeping cards. If you guys play poker, you know what it is like. A good poker player, you don't know what they have in their cards. They keep them. Values others. You have willpower as well, and you give some to others, and you're very assertive. I want to go quick a little bit because I want to do my little situation test. Understanding others. Look outward. They have feelings, those people. Use your heart. And sometimes role play. Put yourself in their shoes. You say, how would I think if they would come in that situation? I never lived it. It's immersion. What can I ask someone? Have you lived this before? Management and team building, working with others, is not single. We always use the word we. We seek help from others. Be receptive, and then the worst in there is charge emotional. I put two, loving person there. I could have put two angry people there in the same way. These are charge emotions. How do we deal out of it? How do you deal out of it? You guys must have relationships with a partner, and sometimes things bad happen. What do? You keep fueling the fire, or what the best thing to do? Take a break, 20 minutes, come back. Patience, time will change perspective. Managing those relationships. Show people you value them. What I do with my staff on their birthday, I send them flowers. And I say, it's just my way of saying thank you to you. Bring a bigger sunshine in your life. And then when they see that on their desk, they feel appreciated. So I value them. Doesn't take much sometimes to make people appreciated. A thank you is worth millions of dollars. To your advisors, say thank you. To your postdocs, your technicians, say thank you. Always negotiate. Others have good ideas. Saying no to somebody is very condescending. Remember the day you asked your dad or your mom a car and they said, absolutely not, no way. I said that to my son too. So then this was not negotiating. Negotiating would have said, it's a good idea, you need a car. How about we just develop a business plan? The message is the same. It's a no, but it's packaged differently. Collegiality and bioengineering, we have a pledge at Clemson, the Collegiality pledge. My mission is to educate. I'm going to make sure everybody does it with that in mind. So basically, they don't love each other. They tolerate, they deal with each other. They work toward one goal, one mission. Your goal right now is to work with your lab, for your lab. So then I asked them, we always have a retreat and the faculty and staff. You could have a retreat in your lab. What is your meter of collegiality now? Are you exceptionally great, hot, or you're cold? How are you going to change this? What you're going to do in the middle to really assure that you're a team member, you are collegial. Remember, it's a part of being a good advisor, a good mentor, a good researcher. So bottom line is this is what EQ, which is emotional intelligence, enables you to do. Know yourself, controls your emotion. Remember that because now we do a test. We have a quiz today. Show empathy. You use your social skills if you say, oh, I'm not. People used to do Briggs-Myers in the old day, and then I've been told that engineers are introvert, and then they're to themselves, and they like to be isolated. Well, biomedical engineers are not. When people say that of you, you tell them, no, I am a biomedical engineer. What's your superpower? These are your words. These are FIU words. And your team focus. We don't have a choice. Let me do a test, okay? I'm going to read the question, and then you guys take a minute to read the thing. If we would have had a poll, everybody would have gone there and then vote on an A through D. You get 10 points if you pick the right answer. 5 points, the second best. The others are 0. So this is very current right now. You are in a meeting with a classmate, I should say a research group mates, who takes the postdoc, takes credit for the work you have done. This must have happened to you. What is it you're going to do? Are you going to confront them? Right there. You're going to stand up and say, point your finger and say, I'm sorry, I did this. Or you're going to say, after the meeting, take your group mate and say, this is wrong what you've done, or postdoc. I really helped. Why didn't you tell them that I helped? Aren't we about a team? You see nothing, you know, you don't want to embarrass people. And then, or you're going to say after at the meeting, when the person stop talking, the postdoc, then you're going to say, thank you, Elizabeth. I did this as well. We did that as a team. And the data said this and that. What do you think is the right answer? What do you pick? Okay. So the most emotionally intelligent way to do it is to do this way. Why would you do it afterwards? I said a lot of people pick that. I did that in my class. And a lot of them picked this one because I said, you don't do this. Because what you're going to do after is going to go from one ear to the other. Postdoc's going to say, I'm going to keep doing this. What you've done there is use emotional intelligence because you use skills. You use your heart to thank the person, and you continued. You made also Elizabeth look better because there were more to the stories than what she said. Your advisor said they work together. And hopefully Elizabeth now understood. Okay, let's look at another one. This one you're going to say, I'm not going to do research. I'm going to go in industry. I'm going to be a project manager. You're so privileged to have so many companies in the Miami or Florida area. You guys will get a job. So you're a project manager and you're speaking to an angry engineer under you. It's on the phone. There is a difference between on the phone and in person. Zoom and the phone is very different as well. What are you going to do? Hang up? Listen to your engineer and rephrase that what you gather they are feeling. Say, sure. Remember sympathy, empathy. Explain that they are being unfair, that you're trying to do your job, and don't get in my way. Or you're going to tell the engineer that you understand how they're frustrated, you offer remediation, and you're going to see if the problem can be solved. So what's the answer? What's the 10 points out of this? 10 points is definitely understanding. Putting your feet in their, your feet in their shoes, using empathy. Hang up, it won't take anywhere. They're going to be even more frustrated. Definitely, they're going to quit on you, and that's bad. You're going to be stuck doing the job. And this one is pity on you. Why do you have pity? The one at the top is the one take the heat. You're always guilty. You're always the one that's solved problem. So the one that is the best is empathy. Put yourself in their shoes. This one, oh, this semester, you wanted an A in a course. You got to see. What are you tempted to do? Sketch a plan to improve. Decide that I'm going to give up. It's not for me. I'm changing major. Doesn't matter. I'm going to focus at the end. I just need to have a good GPA. And then maybe if I get a B or a C in that class, doesn't matter. I have A's everywhere. And I'm going to go discuss with the instructor. What do you think a typical student's going to do? Well, I could tell you that for me, I would say a lot in my class said they would go and discuss their grade because this is what what is your superpower? They're going to go do this, but this is wrong. Your instructor is going to not doing that well. So what the best way is like you sketch out a plan to improve your mark. By doing so, you're going to ask the question, why did I get a C? At the end, you're the one who took the test, not the instructor. You're responsible for the C. Unless there is a mistake. I'm not assuming there is a mistake in the grading. That is a no-brainer. But sometimes people make mistakes. This one is giving up. You don't change major. Last one I have. You've been given the task of managing a team. Now, it may be your capstone design if you're a senior that you have to do, and that's a major big work you have to do. Or your advisor goes on sabbatical, and then you're a postdoc and a PhD, and now you're the lead. And then your people now cannot come up with a solution. What you're gonna do with them? And this is a technique, this one I copied from others. This is what you do in management. This is what I do with my department, and I would not be surprised that your department chair does the same thing as well in terms of solving this. When things are static right now, people are depressed because of COVID. We had essential access requests for research this summer. It took a long time for us to be able to go back in the labs to bring students. Morale was pretty low. Things are back now, better. So what do you think is the right way? Draw up an agenda, call a meeting, organize an off-site meeting where everybody's gonna be encouraged to speak up, be a team member, ask everybody individually, send an email and say, tell me what you want to do. And have a brainstorming session, encouraging each person to say whatever that comes to mind. This one is a tricky one because I would not have picked really what they said, but the best one is to organize an off-site meeting. This is when we have a retreat. This is when we say, if you are doing any ROTC work or anything like that outside, fraternities, sororities, you guys are good to this. You do that. I mean, Greek life is perfectly, as long as you don't do hazing, you're good into this. So you take people outside, take them out of their environment, they can get the best of themselves, and they will be more encouraged to participate. They won't be intimidated by the walls that they have around them because people have different attitudes depending if you put them in the classroom, in Zoom, in our office, or outside. So this one, why does it only have 5 points? I have a brainstorming session. It's just, so it's not different really. You're gonna see that's the same thing. But this one, the D, is in their environment. So people get intimidated. They don't get out of their cocoon. So A and C are not good. These are the cowards who do that. This one, you try to solve something, you don't really know the dynamics between people. No feelings here. And the same thing with this one. This is typical old management. Where I have an agenda. You do that when you do business, not when you have to solve problems. So that was not the case. So we have a take home now. our take-home message is about for research. How does that fit into this? She said, well, she wrote about classes, and then she talked about problem solving and management, talk about having a team with engineers. How does that fit with me? You see that this is the word map of emotional intelligence. Mind control, brain, perceiving, all those keywords we talked about. Everything here has an essence of increasing productivity. Do you think really that a team that is super emotional intelligence driven is not going to produce? They'll be good, they'll be happy, they'll feel content to go and work. They will love what they're doing. They feel appreciated. Problems are solved there. It's gearing toward that. They collaborate. They see that everybody has something to do because the leader, you, knows what everybody should be doing. And this is an essence in building a team. You don't assign someone, like don't ask me to do CAD. I'm not good at AutoCAD at all. So don't ask me if I do design to do this. Ask someone who knows. Give me what I'm good at. So it's about collaboration. It's about you knowing your team. And those three pillars, this is what research is all based on. So then I think this is kind of a take-home message for this. So I'm on time. I have a minute to do my pitch. So now I'm going to pitch to you why you should come to grad school at Clemson in bioengineering. And like I said, you know, it's drivable from Florida. We have a large portion actually in biomedical engineering undergrads who are coming from Florida. So maybe somewhere in your high schools. And not all of you are from Florida either. Maybe I have some of you from South Carolina, so you can come back home for grad school. So I would really like to have a partnership between Clemson Bioengineering and Florida International University in Biomedical Engineering so that we can exchange for graduate programs. We bring different skill set that you guys don't have. Together, I think we all do great things. So I want to encourage you to go visit our website. And these are our latest newsletters. So you will see how student focused we are. And hopefully we all bring a little bit of emotional intelligence in our stories. And we have slogans, you know, I like to bring students to what we do. So over the years, I have a senior challenge. So I teach the seniors, I do the senior seminar, which is our professional development course. And then I gave them $250 each, a team of 4, so each get $250. And they will develop a slogan for the department, which is brand driven. So one year they came up with educating thinkers, leaders, entrepreneurs. So the goal is that when they graduate, they can think on their feet, they can lead, and they can have entrepreneurship skills. Doesn't mean you'll have a company. It means you'll be a good employee wherever you're going to go. I have another one, Team BioE, exemplifying collegiality. We have apparel. Everybody wears those shirts, and we have that on. And this past spring, we had the seniors do the same thing, and they came up with BioE strong. People use the word strong a lot now, don't they? It's everywhere. We're all strong. But what the students have done is that they found a meaning for what it meant for them to be strong. They are striving to reach opportunities, network, and goals. So this was the class of 2020, the one that I brought to you with the tiger paw and the mosaic. This is the back cover of this newsletter that we have dedicated to everybody who's helping us be safe during this pandemic time. So, so participation for us is like, you know, we try to do it at all levels. We're very diverse here. I have 49% women, 51% male, including the grads and the undergrad students. We have a very large portion of minority faculty. We are the most in our college, the most women, the same thing for you, you know. In your college, you are the ones who are leading, you know. You're not only talking, you're not only walking and talking, you are doing it, you're exemplifying it. So this is who we are. And then we'd love to have you as a PhD student. And then if you want to do Master of Engineering, we have a great program. We have 1,800 alumni in the country, and then mainly all in very high positions in major companies like leaders at Johnson & Johnson. The world Toma president is we're bioengineering here, grad at Clemson. Former CEO of Medtronic was a Clemson grad as well. So you see that. So there is value here. And then we don't have hurricanes here in Clemson. We have it in Charleston. We have to evacuate. You know what it means. We have a plan for this. We all set up. We have them relocate to Clemson in hotels. So I would welcome you. Please come visit. That'd be virtual, or that'll be just with me. And I want to thank you all. This is our last special edition newsletter. I wanted to thank you personally for listening to me today, giving me some of your time. And then hopefully if there is one thing you remember is the grade. Don't go see your instructor to get a grade change. And this is our newsletter dedicated to all those who are supporting us in our classrooms and not being paid. The guest lecturers, those who come and then talk about things that we're not expert in. So that said, I'm going to, there are some Q&A here.
Thank you so much for a great talk, Dr. LaBerge. I think it was at the right time, at the right place to hear something that brings or raises up the spirits of the students, the faculty, and everyone. And you're a great speaker. I don't have anything to add on to it.
Thank you. Do we have a minute to answer those questions?
Yes, yes. So
I'm going to go with Thomas. So Thomas, you had a very, very good question here. Avoidance. I call that creative avoidance. Jonathan Black, I don't know if you know this man. Jonathan Black is considered to be the grandfather of metallurgy and biomaterials. And I was very fortunate that Jonathan was at Clemson when I started my career here. And he wrote many books. You must have seen that in your biomaterials course. So Jonathan always said, never burn the candles by both ends. You need creative avoidance. Take a break. When you're tired, don't sit there and you do that. This is such a good quality that you should have in your life. Take a break, go take a walk. If for you it is just to go hang out with your friends with a mask, social distancing, you do that. It clears up your mind. This is what creative avoidance is. Not always stick there when the problem does not work. When you do an exam, if you don't know the first answer, you don't stay on it. You move on and then you come back. That's a bit an example of that. Nicholas asked, how have you seen your colleagues and team being affected by imposter syndrome, and how do you deal with this as a leader? This is dishonesty, this one. And it happens because people feel fame, power, and glory. And they put themselves on the pedestal. The higher you get, the more you are like that. It hurts when you fall. It hurts bad. So those people eventually, you know, that they will always be cut down the road. Don't be that. Be very authentic. I had one slide that I took away this morning, took off of my slide show because it was too long. It was authentic. Like the mirror. What we want people to see us. But you don't lie. You cannot keep lies forever. And if you take a lie and you keep it on for forever or for a long time, it's going to be exposed. So we don't do this. It happens. But as a leader, you need to be able to detect that. Make them talk, really to see who they are. And this is not something you would confront with anybody. You take a side and you tell them, you're damaging yourself by doing this. I hope I answered your questions. Amir, how can emotional intelligence be applied into biomedical engineering? You guys are living it. You apply it day to day because you're working with your right side of your brain and your left side. Engineers are normally on the left, and then bio-sci on the right, liberal arts on the right, humanities. You're bringing both. You work with patients. Most of you will have to do an IRB, getting a patient consent form. You have to put yourself in the mother who now you want to have her consent on her son who you want to use a COVID vaccine on. Oh, that takes emotional intelligence. It's packaging. Remember, no is not good, but it has to be said. How do you package it in such a way that is heard? So you do that every day. And John, do you work with other types of engineers? Yes, we do. Me personally, my background's mechanical, so I still have a lot of students in my lab who have traditional backgrounds. In our department, we're very much open. We have a very good pipeline of biosci microbiologists who are coming because we do medical device recycling here. So our department is really well open to everybody. Our electrical engineering faculty are very strong on imaging, photonics. Your department is too. I did a bit of research yesterday. And so definitely you would have a home here at our 3 campuses. You can pick what you like: urban, hurricane-driven, great restaurants, beach-like, which is like you have, you know, maybe you want something more like mountains, which Clemson offers. We're in the mountains of South Carolina. So, but anyway, when we are able to, please come visit, and I will give you the royal treatment, I promise.
Thank you once again, Dr. LaBerge. That was an excellent talk.